Hello, Francis.
Hello, Dr. König. How are you?
I'm good. Good to see you.
And you, it's fabulous to see you. So tell me everything that's happening at Villa Stéphanie. We're so excited. We've got an opening date from you.
We have an opening date for next week, 10th of June. We're very, very excited as well. There would have been a possibility to go earlier, but we wanted to be ready, which means that we have access to spa, with access to the pool, with access to the gym, because this was kind of a problem up to now. We are, from my point of view, from the medical point of view, very, very well prepared in terms of all measurements to be safe. And obviously the hotel used the time to get the highest possible kind of renovation state they could be doing, because we've been working all the time in the hotel, in the Villa Stéphanie, doing our job during the lockdown. And now we're looking very much forward to see you and your guests again.
So, first of all, was the area around Villa Stéphanie, Baden-Baden, affected badly by COVID at all? Not really.
Okay, maybe I start from now. We are more than 4 weeks with no case at all in Baden-Baden.
Amazing.
We had obviously cases. Southern Germany was affected because we're close to Italy, we're close to Switzerland, and but we never had any overflows in hospitals. Everything was always in a controlled way and manner. We all adapted to the clinical standards, to the hygienic standards, also in our clinic. Which meant for us that we had a different kind of opening hours for people with possible infections, and for those of our patients with no infections, we have kind of a COVID time when people will call us, even now, because we still have people saying, I got an infection, I got a problem, and then we don't know. Half a year ago, it would have been a flu, or would have been a runny tummy. Now everything could be and can be. So we do still separation in any kind of infection. And one of the signs that we've been working well is that none of our staff in both of our clinics did not get any infection. And I think we tested about 30 people on ourselves positive, which means we tested, I don't know, 200 to 300 people overall for the genetic testing. This is the spot testing. And we do the antibody testing in our clinic, which is a test which is done in a minute. So we can do also, for those people who think I might have had it, we can do the blood test, we can do the quick test for the antibodies. So we are fine. Our area was very alert. But looking back at it, we managed very well.
And of course, you've got your own lab on site, which is a huge,
we have
farming them out. They don't have to leave the building, come back in again. So everything is done on site there.
Well, we have to differentiate. We have lab work which we do in-house, like the quick fast testing for the IgM, IgG testing. We can do in-house. We do a double testing, we send away. But our lab is physically 5 minutes away. So if it's urgent, we drive it to the lab, and then we have a max of 24 hours to get the results.
And I believe you are going to introduce, or you have introduced, some programs specifically geared around sort of helping the body, the immunity system, for people to really defend themselves against COVID. What sort of programs are you introducing now?
You see, if we look at it in a realistic, constructive way, COVID is a virus of the viruses overall. So if you all remember, the flu viruses are really different. In the end, complication rates are similar. The problem with the COVID is that it has a high infection rate. It spreads faster. So number one, on property in the hotel and in our rooms, we have special air cleaning devices, because transmission primarily goes through the air. And there are a lot of tests done that if the air is clean, no virus can affect you. If you're not directly exposed to it in terms of being spit at, or you get exposed to body fluids, which doesn't happen because we keep the unnatural distance, because we're all humans, we want to be kind of close, but we keep the distance. So infection is close to zero, because the rooms we work in are cleaned continuously by automatic devices. The air is cleaned. We use overnight ozone to clean the rooms and our treatment rooms. So from that point of view, we are preventing. Number two, we have specific programs where we do certain analysis. How is the immune system? We take the history of the patient. We supply them with all necessities like the vitamin D, with the vitamin C, and then we individually obviously optimize the programs. We know melatonin helps, so we have all ways and means to, first of all, stimulate the immune system specifically. Second of all, to be able to fight the coronavirus when people have it. We have experience in treating people. We don't send them into the clinics necessarily. That's not the program we have in Germany. We keep them, if there is a suspicious infection, keep them in the room, for your test results, do the treatment, no complication, do all treatments in-house. So I think that's one of the big differences, and this is why Germany was very successful, because we separated those symptomatic in terms of clinical needs to go to the clinic from those who don't have to go.
Yes. So presumably, if somebody turns up at Villa Stéphanie and they developed some sort of symptoms that you sort of give you red flags and you think possible, you can handle that anyway. It's not going to be something that will concern you.
No, it's nothing new to us. We would handle it directly where we are on the spot. We would definitely not send anybody to the hospital, which is not a nice idea for none of us in any case. We do our testing. We obviously keep the very person to the room and feed them and take care of them and see them. And then with most likelihood we'll have a negative test, because, as I said, the local area is more than 3 weeks, now close to 4 weeks, free of any new case. So what I say all the time is, if we get a new case, it's not from our area, then it's important. So if somebody comes and has a symptom due to traveling or due to exposure on traveling or from home still, we will have measurements to have a fast diagnosis and to take care of the person. So we're not scared of that. We don't want that, obviously. We would like to keep the place continuously free, but also the hotel has measurements so that infection lines are very well kind of able to be followed up, so we don't have to isolate everybody in the end. But obviously, the best situation is we keep the system clean. As I said, all measurements are done for that. We have a regime which is still pleasant enough to have enjoyable time. We would prefer it to have without any other restrictions, but it is well managed. We have different teams. We have the ways are all kind of defined, and as I said, our rooms are not like left like 2 days lying for the virus to disappear. We actively erase any kind of bug, so that accounts to all other viruses or other bacteria. I don't know if you heard about ozoning rooms. The room is basically closed. We blow ozone in it. Ozone is not compatible with life, which means that's why the rooms are closed. Like 2 hours later, the ozone is taken out of the room by the very same machine. 15 minutes later, the room can be cleaned and is ready for the next guest.
Amazing. Now, what about how does it affect treatments, specific treatments? Are there any treatments that are now off the list at Villa Stéphanie? Specific massages, beauty treatments, basic treatments?
So one point is very important. We are now testing all our staff. Each and every member of the staff is tested if they had a COVID infection. Obviously, not for the fact that they have it, because they are asymptomatic, we don't test, but we do test it if they had. Up to now, none of the members of the Brenner's crew has had it, which is a sign for the region that we've been coping with it very well. So all cases we had here, more or less, were imports from Switzerland and Italy. And number two is we have a strict regime for them also, how to go ahead with them if there are any unclear symptoms. And so that leads to the fact that we are not inhibiting any treatments. The treatments are all allowed. Yes, they will be wearing protection masks if they come close to the customer.
Yeah.
We leave it free to the guest if they want to wear masks or not. There is only in certain ways there are obligations in Germany where you have to. This is public transportation for the moment. This is when you go shopping and when you go see a doctor. We do work all time with our masks. So our staff you will unfortunately only see with a mask. Part of the staff of the hotel is basically behind glass, so it doesn't really give you a bad feeling.
Yes.
And everybody else you get in touch with, obviously, is wearing a mask during service. I can tell you from my personal experience now, because lockdown is getting less and less and less over the last 3 to 4 weeks, when the shops started opening furthermore. I've been traveling other hotels to have experience. I was in Switzerland, and I was astonished because there is nothing as a kind of protection, nothing. Nobody wears a mask, there's no protection. It's not our standard, it's their decision. Our standard is going to be till the moment that we are told that it's not a high risk to work without. It's going to be the same, like with doctors' clinics, it's going to stay till August. It's already said 15th of August, next time they're going to redecide. So the measurements are there for full protections, but also full enjoyment. Baden-Baden has the big advantage that it is very clean air. So again, the matter with the air of transportation, we're having a beautiful early summer. You can see I'm tanned, not from traveling, but we're having just great weather. Yeah, and golf is possible, biking is possible, all outdoor sport activities are possible. We have beautiful ways to walk and do like hikes. And we're prepared for that. We are looking forward to be able to offer specifically those kind of services, so you can enjoy the nature and as a protection for the immune system, for the relaxation, because we all have been very much stressed out throughout Corona. And stress is bad for the immune system. De-stress is very good for the immune system. So our biggest ambition is going to be to get the best possible situation with the best measurements and still create an enjoyable atmosphere, an enjoyable surrounding with the maximum security.
And what about the airports in Germany? How are they handling incoming guests? At the moment here from the UK, we're waiting to hear what's going to happen, because we have a strange situation where we're now going to introduce quarantine, which is interesting, but we don't think it'll be for very long. But what are your airports demanding of guests arriving into?
Just wear a mask. The German airlines request you wear a mask. That's it.
Yeah. And for you at Villa Stéphanie, do you require any tests to be done in advance of arrival there? None.
No. We are asking our guests to report if they're symptomatic. We are on property, as you know, and we can take care of those testing immediately.
Yeah.
We have the necessary equipment. We have the necessary lab resources to do that. And we just require guests in a good mood to pick them up and to get them out of the stress they have been in, to give them an ability to have an enjoyable holiday in a nice surrounding. And that's what we work on. We worked on that already the last 2 weeks, having had the vision that we're going to reopen. And so we're waiting for all of our guests of the Brenners, Villa Stéphanie, to welcome them back.
Yeah. Yeah. I mean, I think, do you believe, in preparation for people traveling, trying to boost their own immunity whilst they're at home, what would you suggest, Dr. König? What do you think certain measures people can do themselves at home to, prepare themselves, to boost their metabolism, everything?
Okay. I don't know if you've been following, maybe some of your clients or your partners have been following our advices, which we were passing on to Instagram, and I can only invite you to join us there and see our recommendations. My recommendation very clearly is make sure you have a good vitamin C level by eating appropriate food, which is fresh orange juice with lime, for example. I do take every day 1 to 2 grams of vitamin C myself. I take very regular high-dose vitamin D, which is also known to be very protective, specifically if you're exposed to the virus. A good level of zinc, which is 25 to 50 milligrams of zinc every day. As we are all stressed, I also recommend melatonin. Melatonin is also protecting the cell from the virus to enter it. And if you look at those publications where people say, I'm using this hydrochlorothiazide and blah, 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 all those guys who were very successful were using that regime. They just topped it with a prescribable drug. But they all use the regime: zinc, vitamin D, vitamin C. And this is what we use also in high doses when people come to see us, but giving intravenously. So we create enormous high levels, which are then again boosting the immune system. We use ozone as a medical ozone for treatment. We have a broad spectrum, very broad spectrum to individualize immune boosting treatments. We laid up, how do you say that? We created 2 specific programs, short-term programs, 1-week program, which can be kind of booked as a package for the immune boosting. I think you saw them online. You told, and I can only recommend have a look at it, and you will see how nicely structured it is, and it still gives you time. You're not going to be hospitalized, not going to be seeing a doctor only. It's going to be 1 to 2 hours max, yeah, and then short visits to be helpful and restoring and de-stressing and relaxing.
Yeah, I think probably the biggest challenge facing most people is that fear. People have this fear now, fear of COVID, what it means, what it could mean to them. And it's affecting, I think, people's mental health. And I guess, positivity, trying to do some meditation, mindfulness. I know you're somebody who believes very strongly on that side of medicine as well. So I guess you really would say both systems will work exceptionally well in this particular time.
Absolutely, it is always a combination. This is why I was emphasizing about the fact that the relaxation on its own of the getaway, and I didn't experience it myself. I went for a meeting in Switzerland last weekend. I had to go to Berlin with a patient of mine to the hospital, and just to see a different place to experience again is so mind-opening again. Because we had luxury situation. I'm very honest about it. We were out in nature. We could leave our homes. But for people who had to stay at home, like in a partner situation or a situation where you're not allowed to leave home at all, it was a severe stress. So it's mentally stress, it's physically. Remember, I just said mental stress transforms into physical stress. Physical stress transforms into or changes into deprivation of the immune system. So this is now we have to work the other way. So de-stress, do everything for the immune system, get back into sports. We all gained 1 or the other pound during the crisis because we had kind of nothing more to do than to please ourselves with food. Maybe 1 or 2 glasses of wine more than usually. But let's now restart it. Let's see the horizon is there. The horizon is there that this kind of situation which nobody has seen ever before, nobody has experienced it before, nobody ever talked about a situation that the world would be stuck at one time for one reason, all new. But we learned from it, and we start reflecting on the positive sides of it as well. That's what we have to do, and we now have to deal with the aftermath. And we will do very well with it because we have to approach it positively. There's no other way to do it.
Yeah.
If I look at negative sides all the time, it's not going to help us. We're going to be assisting that. We have mental health very well educated, very well English native speaking health, mental health assistant on the ground with certain programs. She has also developed certain ways and techniques to also follow up with our guests when they go home, to go through the new social media devices and help them having interviews once a week to continue working.
Yeah, I mean, I think, is a vaccine going to be the answer? Are we going to get a vaccine? Is it an answer, do you think, or no?
No. If a realistic view on vaccine is if at all, I say if at all, I'll give you a small explanation why I say so. When we will be talking about mid to end of next year. Number one, they're working on a different way of vaccines, the classical way of kind of vaccinating you with the dead material of the original virus. They have been working on that on the first COVID bugs they had. They've been working on the Ebola on that, and nothing worked. They've been working on HIV, which is also a retrovirus. Hasn't worked. HIV, how long is that exposed to us? This just shows you how complicated it can be to develop a vaccine. What they're trying now, one of the ways it means is that they're copying part of the genetic genome, the genetic code of the virus, and they want to get that into our body. So, I mean, explaining it to you, it makes you feel uncomfortable already a little bit. So we have to wait and be very careful and see the studies properly. But I wouldn't run into the first vaccination there is if I'm not a high risk patient. And one has to look at it. If we look at our figures, we are having a complication rate overall which is below 1%. Yeah, and a mortality rate which is maybe the WHO said if you have a mortality rate of 0.4%, so 100 people who are sick with symptoms and 0.4 of them die, then you have one below the normal influenza. And we have to be very clear that it severely affected those who were already severely sick. And everybody says, yes, but this one guy here and this one child there, but this is not accountable because this is a super minority who had such a weird come out. The general case, if I speak to my colleagues from hospitals, they said the normal patient in Germany was 80 plus, so above the normal death time. In Germany, the average age when you die is 81. People have been above that age. And they had one page of diagnosis, we say, which means a lot of chronic diseases. And the second page was all medications the person was unfortunate. And if you would have an influenza in the same situation, your complication rate is unfortunately, it's nothing I want to paint brighter than it is, with all respect. And if you lose somebody who's your relative, it's dramatic. But it is dramatic in that case and in that case. If it's the influenza, if it's an aggravation of hypertension, if it's the COVID. And we've been so badly exposed with COVID kills. Yes, it does. Why does it kill so many people? Because it affects so many people at the same time, number one. Number two, if it affects so many people at the same time, then many health systems can cope properly. Then the systems we're also learning with time. Yeah, number three. So all comes together and we have to face it. It was unpredictable in the beginning. It is a catastrophe if it's not managed properly from terms of general management, is to isolate, to do social distancing. We can go hours in discussing if the measurement to that extreme or that extreme is right or wrong. But in the end, a moderate lockdown, a good social distancing helped definitely a lot. We still unfortunately have to pay for that in the aftermath, which I spoke about early on. But as I say, let's get positive. We are getting over it. We see it here, it's over. In Sweden, it's over. You guys are getting much better in England, yeah, because you're a little bit later than us. Just imagine if you just count back and you see the rising, then you're just coming after us. And there are specific problems in the health system in England, which is nothing new. It was not the situation which was unknown in Germany. We just had more intensive care beds, but we didn't use them. We created from 25 75,000. So we kind of tripled them in 4 weeks, which is enormous, costly and everything, but we wanted to be prepared. And some systems were able to work faster. Some systems made horrible mistakes. I mean, I don't want to speak badly about Italy, but they made horrible mistakes. And you will see in the aftermath there as well, the discussions, why did it go so bad? Other systems, French system, only in certain areas, also again, same reasons, mistakes in management. But then again, they were earlier than us. I can't point a finger. We learned from them. And just to kind of see it off, we have a positive horizon. We know how to control the system. We know how to treat it better. We have precautions. We can stabilize the immune system. And let's take it from there. And I can only invite the people, look at your personal situation. Don't travel if you are at high risk. I would not recommend still anybody in a high personal risk, being of above 80 and having chronic problems. If I have severe chronic problems, I also wouldn't travel now. No reason. I'd rather go in my surrounding and relax there. We have to prevent exposure of high-risk patients, make sure that the rest gets healthy in total again, to get economy going again, to get traveling going again. There's a huge meaning of traveling to our mental health as well, to social health as well. We need it. It's part of our culture. And we have to come back to England, and you guys have to travel the world again with an appropriate sense, in a positive, constructive way. Where do I go? Check the measurements of the places you see. Go to restaurants where you know that they follow up the regulations properly, and we will see them loosening up very fast. But we shouldn't kind of unplug all measurements. We are positively aware, and we will diminish them if we see results. Opening in Germany did not rise the figures. We are continuously going down with the figures, even since lockdown is loosened up massively, continuously going down day by day. So, as I said, in terms of is it risky to come to see us, I can purely say our region, there is minimum risk. The risk to get influenza is higher, but it's summer. There are no infections around either way. Things go outdoor. Obviously, nice travel as families or as a small group and stay together with a small group. Then the risks are also diminished, and do what basically is taught and told. Disinfection of hands. When you go too close, use the mask, and that's it. And the rest is enjoy life again. Get positive.
Exactly. I mean, we all need to start enjoying life again.
This is a good way to kind of put it together. Let's enjoy life again in a very positive way, but with a certain responsibility to the problems we had, with respect to the problems we still have, but with the outlook that everything is going to clear up in a very nice and smooth way.
Wonderful. And we're just very happy that Villa Stéphanie is open now, and that our clients, have the option to go back to you. Thank you very much for your time. It's always a pleasure.